Hey guys, this is Thomas from Nurse Money Talk. Now, in this video, what I want to do is I want to answer 10 questions that relate specifically to nursing school clinicals. Now, make sure you stay till the very end because at the end, I'm gonna give you a resource that will really help you throughout nursing school. And then also, I'm gonna give you a way you can you can ask your questions and potentially have it also answered as well, possibly either with a blog post or right here on YouTube. But before I get started on all of that, if you are not a subscriber, I want to go ahead and invite you to hit that subscribe button. And then if you find this video helpful, would really appreciate also a thumbs up as well. Let's actually go ahead and dive right into it. The first question, and that's just talking like very generally, which is what should you expect when it comes to clinicals? Now, in general, nursing school clinicals, it is a mandatory part of nursing school. You'll probably have at least like one clinical rotation a semester. Hours will vary. I'll talk more about that in probably in one of the upcoming questions. The clinicals is more or less on a pass or fail system. And so as far as clinicals is concerned, I've actually always considered clinicals one of the easiest parts of nursing school. Now, of course, when I say easiest parts of nursing school, I use that term very loosely because clinicals, it is going to be a lot of work. It is a lot of work. I think a lot of it is also going to be a lot of busy work. I think you'll also learn a lot as well. But for the most part, it's things and assignments that as long as you just put in the effort and do what's required, you're gonna end up passing clinicals, you know. And of course, just as importantly, as long as you're not a complete jerk or make the nurse that's precepting you or that you're following, the staff nurse that you're following's job any harder than it needs to be, because that is also a big no-no. Now, kind of narrowing it down a little bit from the expectation of clinicals, the next question was just in general, what are clinicals? So the clinical is when you as a student go out into a clinical setting for real, like kind of hands-on experience that's supervised by a licensed nurse. Now, in some situations, it's going to be your clinical instructor, which may or may not be an actual staff at your university. It might just be like an adjunct, but or in a lot of cases, it's also just going to be the staff nurse, that's working at that particular facility. Question number 3 is, what do nursing students do in clinical? So in general, what you'll see is that what you'll do in the clinical setting is more or less the typical activities that is done by that nurse or by a nurse in that clinical setting for the most part. So most common activities nursing students will be doing in clinicals will be passing medications, doing some kind of patient assessment, doing procedures or skills such as starting IVs, Foley catheter insertion. Honestly, in a lot of ways, I was actually thinking about this the other day. It's like a lot of the things that you'll be doing in the clinical setting will be stuff that like nursing students are like super excited and everybody's rushing in to go and do like start an IV and do a Foley catheter insertion. And then like actual nurses, like licensed nurses, those are the things that they're typically trying to run away from or not have to deal with. So it's kind of interesting once you actually get into it. Number 4 is, when do clinicals start? So typically a clinical will start probably around about the first semester or so. Depending on the program, of course, all of this is going to be very dependent on the program and will last probably until your very last semester. And number 5 is, how long are clinicals? So all of this, once again, depending on the semester, depending on the actual clinical setting itself, depending on all of those things, it could last anywhere from up to 8 to 12 hours. at a time, or anywhere from, a couple times a week, maybe to it lasting like the whole semester or just part of the semester. Next one is, where do nursing students do their clinicals? This one, the typical spots you will see will be, of course, hospitals. And then from the hospitals, you'll then branch off into different departments like the ER, the ICU, the med surge, and all of that. And then of course you'll have like some clinics as well, but then you'll have like others as well. So for instance, like I thought I'd seen, I saw somewhere where some prison systems might actually take in nursing students as well. So for that's interesting because prison systems, they will have like clinics and kind of like their own health and medical center kind of built in there. But then also one of the spots I actually went to for my own clinicals was actually, it was like an adult day center. So it was pretty much a place where adults could be honestly kind of dropped off by, so these were adults who were probably like handicapped, so they might not have been able to live on their own independently completely. And so whoever their caregiver is might go drop them off there so that they can be taken care of while the caregiver is able to go do something else. So I found that was kind of interesting. Number 7 is, what should I bring with me to clinical? Like as little as possible. That is just pretty much the all-encompassing answer. Nothing valuable. And even if you're told that you'll have a place to keep it, okay, so when they tell you you'll have a place to keep it, that could mean anything. That could just mean like it's just gonna go behind the nurse's station. That could mean it's gonna go in the break room where the regular staff nurses might have like a locker that locks, but you probably don't. And so it's gonna be, you don't want stuff left out in the open, because even areas where like it seems secure, unless it's an actual locker, anybody can easily get into that room. And so you don't want anything valuable that's at risk of being stolen. Typically, as far as like non-school stuff, like for the most part, you're probably looking at just like any snacks or lunch. Lunch is an interesting one because depending on when your clinicals are or what time, the cafeteria may or may not be open if they do have a cafeteria, and or like they might have a way for the patients to get food, but not necessarily for non-patient, so for staff members to get food. So kind of keep that in mind as well. And if there's not a way for you to get food there, if there's not a cafeteria, a lot of times they won't actually let you leave the clinical site either. So you'll need to double check the lunch situation, find out if there's a fridge or anything like that. Honestly, even if they tell you there's a fridge, I would probably just like bring like your lunch bag that's insulated and then just put like ice packs or whatever inside of it, so you don't have to rely on a fridge, which from what I've seen from normal fridges, the staff nurses a lot of times don't even have enough space to put their own food in there, let alone some nursing students coming in there trying to take up space in there. So that's probably some big highlights I would hit for the non-school stuff. As for the school stuff, of course, your stethoscope, scrubs, ID badge, make sure you don't forget that. Typically, they won't even let you go on with the clinicals for that day unless you have that ID badge. Make sure you have comfortable shoes. If you don't have comfortable shoes, make sure to get yourself comfortable shoes. And of course, make sure that any assignments, care plans, or whatever, that you bring that with you. I didn't include textbook in here. I feel like a lot of nursing students tend to lug those big things around. I would, unless there's a specific reason why, so maybe you'll have, I don't know, maybe there's an assignment that requires it, I don't know. But unless there's a specific reason, I would not carry your textbook around with you. I would not carry it around with you to try maybe I can sneak off and study. probably won't work out. So I would just, unless you really have to, I would leave the textbook at home. Don't carry those back-breaking books around with you. So number 8 is, are nursing students paid during clinical? This one's an interesting question that I've seen asked a handful of times. The answer to that is no. You actually are, if you think about it, are paying for clinicals, since you're paying for tuition and fees and whatnot. I think the schools might actually be also paying the clinical sites, but I don't know how all of that works. But either way, as far as you're concerned, you're actually paying to be there to learn. I think some students might actually, maybe they're comparing this to, I think it's residency, to where doctors get paid a little bit of something while they're working as residents. I believe that's right. But either way, that's not the case when it comes to nursing school clinicals. So you don't get paid, and you'll actually will be paying for that. Number 9 is, can I do clinicals on the weekend? So yes, some programs will have weekend options. Sometimes if they're divvying up like maybe schedules for a particular clinical rotation, there might be a weekend option. There might not be. I think that's just kind of going to be dependent on your program. But if you are interested in weekend clinicals, it doesn't hurt to kind of double check with your nursing professors, I should say, and then just kind of see if that's an option, or if there's any way you can kind of put a preference down for one. So number 10 is, what should I avoid in nursing school? This one is a this one is a big one, but I'm actually going to hit on just 2 things. So number 1 is, for heaven's sake, keep your cell phone put away. So even if you're going to have your cell phone out, like if I'm just being realistic, you're gonna have your cell phone out maybe to text your significant other or whatever. At least just be smart about it, you know? Like at least try to be a little bit sneakier about it, instead of just having it like pulled out and you're just like obviously like distracted with your cell phone. So just be smarter about it, and don't take selfies. Like just don't. Like when you take, and then, or like you take selfies and then you start posting it on social media, because if that ends up having any like identifiable patient information on there, that's a problem. Even if it doesn't have any identifiable information on there, your nursing program probably has rules and guidelines in place. And if they start seeing social media posts of you in clinical sites being posted, that might not be the best look. So I would definitely be mindful of what you're doing with your cell phone. Be mindful of your interactions with social media. Don't badmouth a facility you're going to. Don't badmouth nursing staff that you've been following there. Don't badmouth patients as well. I mean, these are all things that I would think would be kind of common sense. But if you look at some of the news articles out there, you can kind of see that it's not really as common sense as I would think it is. The second thing I would also mention is just to avoid the drama on the unit. I mean, there's going to be drama everywhere you go, and you just want to be mindful of not dragging yourself in the middle of that. You are a student. You are there to learn. Put your head down, do what you need to do, and then get out of there and just wash your hands of all that drama. So just be really careful of that. Now, I promised you stayed all the way till the end. I actually promised you some resources. One is a really great resource that will help you be more successful in nursing school. Just go to NurseMoneyTalk.com/nursing student academy. Link, of course, as always, will be in the description below. And so if you're just struggling with different topics or anything of that nature, it's just a lot of great resources there. So definitely check that out. So second thing is that if you have a question that you want to ask and, and possibly have it answered by me either through YouTube or possibly even via like a blog post, you can go to nursemoneytalk.com/ask. Once you get there, you'll of course see the submission box and then of course some guidelines and whatnot to kind of keep in mind of. But yeah, so if you do have a burning question and you haven't found like some answers to it and you want to ask, definitely check that out to ask your question at nursemoneytalk.com/ask. Now, the video you'll see over here that'll show up to my left will be some more videos that will help you navigate just this nursing school and nursing student life. So definitely check those out. Anything else, let me know in the comment sections below. Thank you so much for watching this video, and I will catch you very soon in that next video.